Welcome to the Visibility Gap. I'm Dr. Jen Ashton. Today we're shedding light on an unseen issue that affects millions of women: chronic pain. Women make up 70% of chronic pain sufferers, yet their experiences are often misunderstood, underdiagnosed, or dismissed as psychosomatic. Despite advances in medical research, this issue remains largely overlooked, leaving countless women struggling to be heard and validated. So in this episode, we'll explore the challenges women face in having their pain acknowledged and the psychological impact of being dismissed. Our panel of experts will discuss practical changes communities and businesses can implement to ensure women's pain is taken seriously. But to start, we'll hear from someone with acute knowledge of chronic pain, Kiara Randolph. Kiara, first of all, thank you so much for coming, for sharing your story, which I know had a lot to do with physical pain, but also psychological and emotional pain.
Yeah.
I'm wondering if you could start by describing the emotional and psychological distress that you felt.
Honestly, the entire duration that this went on was about 5 years. In the beginning, when it first started, it was July 2019. I woke up in the middle of the night, and I remember I was sleeping over at my friend's house. And I had this pain where it just brought me to my knees, and I've never had kids. I've never had contractions. I just felt like I was either dying or going into labor. Neither was true. But I remember I couldn't explain the pain that I was in. Went to the ER, and they ran all these tests on me. They couldn't figure out what was going on. And the doctor that was there at the time, he just told me, yeah, you have a hemorrhagic cyst. It's about the size of, I think he said maybe a grapefruit or something. It was about, yes.
So a hemorrhagic cyst means that's the medical term for bleeding into a cyst.
Yeah, blood
and the
filled,
size of a grapefruit.
Yeah.
Most grapefruits I know are about this big.
Yeah.
Your ovary normally is about that big.
Yes. I was in so much pain. I remember just like crying and not understand. I didn't know what was going on. My ovary had gotten so large that it twisted my fallopian tubes. Mm-hmm. And then from there, that's where I think the pain was coming from, because my tubes were twisted. My ovary was now losing circulation, and my ovary was dying.
But from the time that they had done either an ultrasound or a CAT scan and said, you have a grapefruit-sized cyst on your ovary, and the blood supply to your ovary is twisted and cutting off the blood supply to your ovary, you were not seen by a gynecologist?
No.
What were the options for managing this or treating this that they told you at the time? Do you remember? Because this is excruciatingly painful, and it is, in fact, a true surgical emergency.
Yeah. So from that point forward, he told me, he said, you know what, you'll be fine. Your body will just correct itself. Go home, get some rest. They wanted to do a checkup with me a week later, that Friday. The doctor that saw me now was a Black female doctor. She looked at me and she read my papers, and she was kind of confused. She was like, you're very stoic for what you're going through. Your emotions don't really equate to what you should be feeling, the pain you should be in. I think at this point, my emotions were just shut off. She was like, we're going to run some more tests. They put me on the phone with the surgeon, and she was like, I'm so sorry, but we're going to have to do surgery. I remember just crying. I was now at this point extremely emotional, just because of things that I've seen in my past and how I feel about surgery. I was just really, really scared, really terrified.
And what kind of things in the past informed how you processed that emotionally at that moment?
There's been numerous of people in my family, mom's side, dad's side, that have died during surgery. My aunt, my grandma, one of my cousins, he had complications from surgery. He died during surgery, brought him back to life, and now he's not able to speak or walk. And my uncle, I'm saying there's multiple people I can count in my family directly that have just died during surgery. And that was the only representation I've seen from, the results of surgery. So I just was like, I'm too young. I'm 20, I'm about to go in for an emergency surgery. And I'm sitting in this room, and everyone, I remember this nurse was talking to me, and he said, why are you so nervous? Why are you, it's going to be okay. It'll be really quick. And I was just terrified to go through, especially knowing that it was against my will. I didn't want to have this surgery, but I needed to do it. I had about 2 hours to prep for that surgery. We went in, and I remember just coming out and just being in so much pain. Still to this point, they didn't diagnose me with anything. They just said, all right.
You've been through so much.
Yeah.
And again, as you mentioned, you were 20 years old.
Yeah.
It's a lot for someone who's 30 or 40 to go through this, but you were 20.
Yeah.
In the emergency room, they told you had a hemorrhagic cyst. And in the emergency room, did they tell you that it had twisted the ovary and the fallopian tube on itself? Or was that figured out later when you went back for that follow-up appointment?
This was told to me the initial visit when I first went to ER. They told me that my fallopian tubes had twisted on itself.
And then they sent you home.
Yeah.
Which, as a board-certified OBGYN, I will say in general, not having seen your chart, not having been there at the time, when you diagnose of ovarian torsion, it is a surgical emergency.
Yeah.
Period, full stop.
Yeah, he told me in that moment, he said, your body should correct itself. Come back Friday, we'll do a checkup, and then we'll see how you are from there.
So when you went back for your follow-up visit and you were seen by a gynecologist and she told you that you needed emergency surgery, when you woke up from that surgery, that's all you knew up until that point.
Yeah.
You knew that you had a cyst, ovarian torsion,
Yep.
and that you needed emergency surgery. What was the next piece of information that you learned now in retrospect, or even your memory at the time? How was it conveyed to you in a way that was helpful or not helpful?
To me, it wasn't very helpful because after I woke up from that surgery, they told me simply just no heavy lifting, nothing above 50 pounds for the next month. Just take it easy. And I remember going home feeling like, obviously, I'd been cut open on my both sides of my stomach, and I think it was like down my belly button.
So you had a laparoscopic surgery?
I had, I just felt as if like someone had stabbed me in my stomach, and they told me, just take it easy.
What did they tell you was done in the surgery?
They told me that they drained the cyst, untwisted my tubes, and they saved my right ovary. And that was the main concern. I remember my mom, I didn't know, I didn't know what was really happening. And my mom was asking some of like the heavier questions for me. And she said, did you save her ovary? Like, is she fine? Or they did. But even still years after the surgery, I still would feel just like excruciating pain where I had the surgery. Still to this day, I really don't know why. I have like, speculations of what it might be, like something some doctors have told me, but.
And so did any doctor explain to you that phenomenon of postoperative pain, surgical pain, scar tissue?
The only thing I've heard is what it might be is scar tissue. But another doctor told me, they said we're not able to see if it's scar tissue unless we do another surgery to open you up and see that it's scar tissue. Since no one was telling me anything, I started to do my own research to try to find out, like, how did this happen to me? Why is this happening? And how can I fix it? And I kind of self-diagnosed myself with PCOS because I was really just like wondering, like, what is this? Why did this happen? And
which has nothing to do with the surgery, but stands for polycystic ovarian syndrome.
Yes.
So let's go back a little bit to the pain and what it feels like. Is it sharp or dull?
Sharp.
And you said it comes and goes.
Yeah.
So intermittent.
Some days I do have dull pain, though. It just feels like a achy pain.
And if 10 was like the pain you had in the middle of the night that first time, worst pain possible is 10, what number would you give this pain?
6, some days 7. Yeah.
So pretty significant.
Oh, yeah.
And does anything make it better?
Rest. Honestly, eating right. Eating right has helped me a lot. Changing my diet.
For the acute pain?
Yeah.
Or to prevent it from coming?
No, simply like when I'm in pain, I know it's because, and again, I can't explain it. It's just, there's certain things in my diet that would make the pain like flare up even more. And I think that's what kind of prompts me to think that this is something bigger than what they have told me or diagnosed me with.
So I have a saying in medicine that I think is so important. because it's so true, and I've used it probably hundreds of times in my 20-year medical career. You can have more than one thing going on at a time.
Yeah.
And a lot of times it can be very hard for people to think about that because either they get a diagnosis or they have a symptom, and it's very easy to become laser focused on just that diagnosis or that symptom. In your case, maybe the surgery and the initial cyst. But there can be 1, 2, 3 other things also going on that all contribute in different ways at different times to a different extent. So you mentioned PCOS, polycystic ovarian syndrome. I like to call that the most common but least well understood hormonal condition affecting women.
Yeah.
Incredibly common. 10 to 15% of women have it. And there's no one specific test for it.
Right.
So it's kind of something we piece together with different kind of clues. One of them is a history of or the presence of ovarian cysts, although you can have PCOS and not have cysts. You know, you've been very descriptive about the physical pain, but emotionally, feeling seen, feeling heard, feeling validated, feeling properly addressed. It sounds like that always hasn't gone so smoothly for you.
It was tough because, I mean, for years I tried to just tell them how I felt. And I never wanted to undermine the doctor and say like, oh, I know more than you, anything like that. But I was like, can we just test, just to take a blood test, just to see like, how are my hormone levels? Never within 5 years did they do a blood test to test my hormones. I just wanted to see simply like, is my estrogen where it should be? Is my testosterone levels, are they too high? Are they too low? I wanted to just see, because maybe I was wrong. Maybe I didn't have PCOS, and maybe.
And was this the same doctor who told you about the cyst, the needing surgery?
Nope, it was not. 2 different doctors, yeah.
Okay. Do you think that your age, your race, where you lived, any of that played a role in this, I'll be nice and call it suboptimal communication, but it was inadequate on so many levels?
Yeah.
Do you think it played a role?
I don't want to have to believe that, but I think it could be a possibility that that's what it may have been. Because the reason why I brought up earlier that she was a Black female doctor is because when I was talking to the first doctor, when my mom was there, my sister was there, we're asking him questions, and he's just like, yeah, like this happens a lot for girls your age. You'll be fine. Go home, get rest. Your body will probably correct itself. Come back in a week, we'll do a checkup. Again, I was 20, and I think he just kind of brushed it off like, you'll be fine, you're young, your body will recover. Okay. I go home, come back a week later, and not to repeat myself, but the doctor was saying, something's not right. I just feel something's not right. I want to run some more tests. I want to do another ultrasound, and I want to make sure that, we take care of this because something is not right. She's the one that called the shot and said that we're going to do the surgery. She did my surgery as well. Mm-hmm. If it wasn't for her, honestly, I don't know what would have happened. Her being a woman herself, she understood, we go through a lot, and you never know like what battle someone's fighting.
So people listening, people watching who are dealing with chronic pain, which is such an incredibly common and debilitating problem, if you could give them one piece of advice based on what you've learned over the last 5 years, what would it be?
Advocate for yourself. Always speak up and be consistent. Be persistent. I mean, if there's something that you really want to know, keep asking and keep saying, can we just see?
I think that is great advice. Kiara, thank you so much. I'm so sorry you've had the experiences you've had, but it takes so much bravery to come and talk about something that's been so painful physically and emotionally. And I know you're helping a lot of people by sharing your story, so thank you.
Yeah, thank you so much.
So to help us better understand Kiara's experience and explore solutions, I'm joined by 2 exceptional experts. Dr. Margaret Rutherford is a clinical psychologist with over 3 decades of experience, specializing in treating anxiety, depression, and relationship challenges. She's the author of Perfectly Hidden Depression: How to Break Free from the Perfectionism That Masks Your Depression. and Dr. Wendy Kline. She's a distinguished professor at Purdue University whose research focuses on women's health, reproduction, and the history of medicine. Her latest book, Exposed: The Hidden History of the Pelvic Exam. It sheds light on overlooked aspects of women's healthcare. Thank you so much for being here today. Chronic pain. Chronic pain in women. Why is it such a problem? Chronic pain is challenging enough, but when you put women and chronic pain together, what are the psychologic and historic or sociologic factors that make it so massive?
Well, the fact that you said 70%, right, of chronic pain sufferers are female, that's remarkable, right? There's the medical aspect of that, but there's also the historical. How do we get to this point? Women in pain, if that's the case, why at the same time is frequently women's pain misdiagnosed, misunderstood, dismissed as irrelevant? Just a women's problem.
Right.
A lot of historians talk about the fact that menstruation is sort of Eve's curse. It's just something women have to endure. It's not really serious. It's just something we have to put up with. And if we carry that assumption into other aspects of our body and suffering, and this belief that, we don't necessarily deserve better, we don't ask for it, that is part of the issue. And then, of course, when we do express pain, we're not taken seriously, right? So it's got this snowball effect. And Kiara's story is a classic example of that, right? That she's very articulate, right? She described very clearly it was either that she was dying or giving birth. Even though she hadn't, she knew it was that intense. And yet that wasn't really enough, right?
People know that menstruation can be painful, that childbirth is painful. And so do you think there's a false comparative standard where women are judged as, look, you're already suffering, but you're stoic. So anything else, we really don't even rank that on your
sort
list
of glossing it over.
Yeah, or anything else that you're complaining about must really not be that bad because we're comparing it to childbirth and menstruation.
I definitely think it could. It gets to that point that pain is subjective, right? It really requires the belief of the person experiencing the pain. And so from an outsider, the expert in the room, the doctor, it depends on the extent to which they believe the person. Or as Kiara pointed out, like the extent to which they're really listening and paying attention. They're more likely to dismiss pain among people that they think perhaps overreact, hysterical, right? They're seeking attention, whatever. If we think of pain, among other things, as being a type of emotion,
exactly,
right? That it's about expression, and people can express pain in very different ways. It doesn't mean they're feeling it any less intensely, but they've been conditioned to express it in a particular way. And often that has to do with how they've been treated. Pain denial, right? If they're not being believed, or if they're being abused or ignored when they do express pain, what are they going to do? They're not going to express it in the same way. The outsider doesn't know any of that. They don't know their history or the context. They're just assuming there's this kind of base scale, 1 out of 10. What are you feeling? As if it's this objective quantifier, but in fact, it's much more culturally embedded. And that makes it complicated.
In other words, a 10 for me might be a 4 for you.
Oh, it's probably a 3 for me.
I'm very one big. But how you use that information, because A, it is subjective, and B, it is how doctors are taught, how clinicians are taught. We have to be able to put it on some kind of a scale for that person, right? And so you bring up a really interesting point, which I think also clearly translates not just physical pain, but mental pain and how they're related. It's still important to ask, what number would you give your pain?
Sure.
But I think it's also then important to ask, well, if this is a 10, have you ever had worse? But how often, Margaret, do you see people, patients, clients who have had significant physical pain or live with chronic pain who then develop as a consequence or direct sequelae psychological pain.
Oh, yes. Oh, yes. There's no doubt about it. And, I also have read some research that, and I have a basic understanding of it, is that the mind actually reacts to emotional pain and physical pain similarly. They don't necessarily determine, the mind doesn't say, well, this is emotional pain, well, this is physical pain. So that is a factor, I think. But of course, when Kiara mentioned it. People sometimes pull away from you when you have chronic pain, and so you can feel more isolated. It has all kinds of psychological ramifications, and just the fact that you're having to deal with, again, here's the word, chronic. This is not something that's just it doesn't have a beginning, a middle, and an end. It is going to be around with me for maybe the rest of my life, certainly for a long time, and even that can feel so heavy. And you don't want to exacerbate it. You don't want to make it worse. Like Kiara was saying, I stayed to my diet. I did everything I could to begin to understand how I perhaps could control it more. She's looking for control. And when you feel out of control, and then it's something that's going to last forever, or seemingly forever, then, your hopelessness, your helplessness, it can certainly lead to some depression. Maybe even making it more difficult to do the things that are going to help you manage the pain. People with this kind of chronic pain, you want to monitor it. You want to keep tabs on it. You want to, like you say, quantify it. You want to do all those kinds of things, but you don't want to become your diagnosis.
And I think also, to that point, the word I would use often is fatiguing, right? It's exhausting to deal with chronic pain, physically and mentally exhausting, because as you try to go about everything else we need to do, activities of daily living, with pain, it takes more effort. What do you think the consequences are of people who have chronic pain not getting good support? And they seem obvious, but...
Right. There's the basics, right? That they start to lose a sense of a community. Yeah.
Spontaneity.
But the other thing I would say is they're going to start frequently questioning themselves. Is this just in my head? Because people aren't responding. It's not like you get flowers when you go to the hospital and you get the get well cards and then you move on.
Goes away.
Yeah. And so if people can't read it, you can start questioning yourself. Is this in my head? Why aren't people responding the way I would expect them to feel? And that can be extremely debilitating, right? And it gets into that question of what's real pain and what's psychosomatic, and that in and of itself is incredibly debilitating.
And I think something else that people do, maybe to try to talk with you about it, they'll say, oh, my aunt has that. Or, oh, I used to have, they'll pull from somebody else's experience with the disorder, the disease, whatever it is, and somehow compare the way it's affecting you to the way it affected the person they know or themselves. And we use these stories to say, well, this is how I understand this heart disease or lung disease or whatever it happens to be. This is how I understand it because I saw Uncle Joe do this.
So a lot of people with chronic pain can feel isolated and alone and detached because of their experience and their condition. What are some positive coping strategies, some real actionable tips for people dealing with chronic pain that are not only physically helpful, but mentally helpful?
I remember a long time ago, John Kabat-Zinn wrote a book called Full Catastrophe Living. And it was all about this marriage of chronic pain and trying to live a fulfilling life. And of course, he's a huge guy about meditation and mindfulness. And I do think that can help in actually detaching from your pain, giving it a name. So a lot of it is, you have to kind of trial and error, see what works for you, just like Kiara did.
Journaling,
huge.
Acupuncture,
exactly.
in certain cases. What about group therapy, support therapy? Specifically on a logistical level, we all work. You imagine there are days that it's difficult to go and do your job, and we're not dealing with chronic pain. What advice would you have if you could imagine that you are single-handedly responsible for making a new policy in the workplace to help employers support people dealing with chronic pain? What would your first action point be?
I think the first thing that comes to my mind is to recognize it as a problem. Chronic pain can lead to opioid abuse as well, which becomes another problem in and of itself. So you want to give people support to maybe work in physical therapy, to work in other ancillary therapies that are going to help the chronic pain, but not necessarily lead to a dependence on pain medication. And if I were running my own business, I would say, I want to help these people with chronic pain and maybe help give them some techniques and some support so they don't overuse opioid medication.
I mean, I like the idea of just simply articulating it, of recognizing it, of understanding that to prove that you're a good employer or worker doesn't mean that every single day when you're not feeling right, you should do it, right? Just think of sports injuries or there's countless examples of times in which actually you're going to be more productive or get to a better endpoint by simply backing off and giving yourself that break.
Right.
But that needs to be rewarded, that you're not going to be 100% every day. And the day that you're 75% can still be a really good day rather than, pushing yourself to the point where, you will cause some serious damage.
And I would add to that, I think that for people dealing with chronic pain, it's so important to understand that it's a marathon, not a sprint, and that there will be good days and bad days, to your point, and that to celebrate even the small victories, which would be, maybe you're feeling a little less pain today, maybe the pain will never be gone, but if it's less, that's a reason to recognize and celebrate, your body and your mind and the process that you've been through. And I would say really think of all of the options, not just like the prescription, always try to get to the root cause of the pain if possible, figure out why the pain is there rather than just putting a Band-Aid on it, and nurturing the entire body, not just the body part that's hurting, I think is really important. But listen, it's with conversations like this that I think a lot of people are just being seen, being heard. Pain obviously is so hard because if you break your arm, you can see it. Right. But you can't always see pain.
Can I jump in and just point out back to the women part of chronic pain? Why is it that so many women are experiencing pain and not getting the treatment that they should be getting? And part of it is so much of this female pain we're talking about, including Kiara's, is about reproductive health. And reproductive health simply, historically, has not been taken, it's been misunderstood, it's been understudied, it's been devalued. All of these things that contribute to this lack of empathy or understanding, particularly since until very recent times, most of the people doing the research and the treatment were not women. Right. And so this kind of distancing and lack of understanding of what could possibly be going on that from the outside looks perfectly simple, right? Her pain was simple. She just needed to go home. No, that the larger issues get kind of swept under the rug too frequently because it's a women's issue and therefore not as deserving of funding or research or conversation.
And to that, I would just add, there are some great men, obviously, scientists and clinicians who are involved in this and helping women to be seen and treated and recognized as they should be. Thank you both so much. I think when you talk about chronic pain and the millions and millions of women who are suffering, I know that this conversation really helped to inform not only potentially their future and their experience, but the support that's able to be provided to them in their social circle. So Dr. Kline, Dr. Rutherford, thank you. And thank you, our listeners. We really hope this episode of The Visibility Gap has helped you and your loved ones feel seen and empowered. If you found it valuable, please don't forget to share it, like it, and subscribe to stay connected with us.